Okay, so let's set the scene. You've got a pretty common medical procedure going on, an ultrasound-guided nerve block. A patient needs some pain relief, right? This is something that happens thousands of times a day in hospitals all over the world. Totally routine.
So, the clinician injects a tiny amount of local anesthetic, just 5 milliliters. Thanks to the ultrasound, the needle is perfectly placed exactly where it needs to be. It's a simple, controlled, everyday moment in medicine. And then, bam, everything changes in an instant. The patient just collapses. Suddenly, this routine procedure has turned into a life-or-death emergency. So the big question is, what on earth just happened?
So in this explainer, we're going to dive into this rare medical mystery. We're going to play detective and uncover the hidden pathway that caused this crisis. And along the way, we'll see what it teaches all of us about the real-life art of clinical investigation.
All right, first things first. Let's get the facts straight. What exactly did the medical team see in those first few critical moments after things went so wrong? Okay, so the patient's symptoms hit hard and fast. We're talking sudden, really bad chest pain, trouble breathing, and what's called profound bradycardia, which is just a dangerously slow heart rate. But, the most important clue here is what didn't happen. There were no seizures, none of the classic signs you'd expect if the anesthetic went toxic. And that's our first big clue. So, the patient is in crisis, and the clock is ticking. The team has to figure out what's going on, and they have to do it fast. It's time to start the investigation and see if we can solve this puzzle. And this is the critical question, right? In an emergency like this, you have to think fast and act faster. So, what are the most likely culprits for a collapse this sudden and this severe?
All right, here are our potential culprits. I want you to think of this like a police lineup for medical diagnoses. Could it be local anesthetic systemic toxicity, or LAST? Maybe an accidental spinal injection? What about a massive allergic reaction? Or could it be something way, way rarer, like a paradoxical air embolism? We've got to check out each one.
You know how detective work goes, right? A good detective takes the evidence and starts eliminating suspects one by one. And in medicine, the evidence is the patient's specific set of symptoms. So let's see how our lineup stands up to the facts.
And this is where the real sleuthing begins. Okay, so if it was anesthetic toxicity, or LAST, what would we expect? Seizures, right? But we didn't see any. What about a spinal injection? Well, that would cause numbness, a loss of sensation, not crushing chest pain. And an allergic reaction? You'd be looking for a rash or wheezing. And again, nothing. The evidence just doesn't fit the usual suspects.
So we've pretty much rolled out all the common explanations. That means we've got to dig deeper. We have to start thinking about a cause that's way less common, but one that might just perfectly fit the very specific clues we have. All right, so after we've crossed all the usual suspects off the list, we're left with a very surprising culprit. Let's finally reveal what was really going on inside the patient's body. The diagnosis? It's something called a paradoxical air embolism. It's a rare event, but it can be absolutely devastating. Here's what happens. Tiny little air bubbles from the syringe got into a vein. Now, normally, your lungs would just filter these out, no problem. But in this case, the bubbles took a paradoxical path, a wrong turn, basically. They crossed from the right side of the heart over to the left, and from there, they got pumped straight into the arterial system, where they can cause major blockages. And this is what explains the symptoms perfectly. Those air bubbles traveled right into the coronary artery. That's the main pipeline that feeds the heart muscle itself. That blockage caused what's called cardiac ischemia, which is a sudden cutoff of oxygen to the heart. And that explains the chest pain, the trouble breathing, and the total cardiovascular collapse. Suddenly, all the pieces of the puzzle just click into place. Okay, so we've figured out the what. It was an air embolism. But that just leads to the next big question, doesn't it? How? How did those air bubbles manage to cross over to the wrong side of the heart? It's time to trace their journey and find this hidden pathway. So let's follow the path of one of these tiny air bubbles. First, it gets into a vein and travels to the right side of the heart. Easy enough. But the next step is the crucial one. It slips through a kind of hidden doorway over to the left side of the heart. And from there, it gets shot out into the arterial system, eventually getting stuck in a coronary artery and causing that life-threatening blockage. So what exactly is this hidden doorway? Well, it's an anatomical feature called a Patent Foramen Ovale, or PFO for short. And here's the wild thing. We're all born with this little opening between the top two chambers of our heart. For most of us, it closes up right after birth, but for some people, it doesn't quite seal all the way, and it stays as a tiny, flap-like tunnel. And get ready for this, because this part is pretty startling. That PFO, that hidden doorway, it's present in about 25% of the entire population. That means roughly 1 out of every 4 people has this little, usually harmless, anatomical quirk. Think about that for a second. And that really is the heart of this entire mystery, isn't it? You have this super common, totally hidden condition, the PFO, that created the absolute perfect storm for a very rare and devastating complication. The patient had no idea they had it. Nobody would until this exact moment.
So after all that, what's the big lesson here? What's the key takeaway from this whole medical detective story? Well, the source material actually uses a fantastic phrase for this, the constellation of symptoms. I love that, because it wasn't just one thing, right? It was the unique pattern of things. The severe chest pain and collapse, combined with the absence of the usual signs like seizures, that pointed directly to the right diagnosis. Recognizing that specific pattern was the key to cracking the case.
And that's really the power of this story. It's such a powerful lesson in clinical reasoning. It's a reminder to always think broadly. When the evidence just isn't fitting with the usual suspects, you've got to be prepared to look past them and consider the rare possibilities.
And all of this leaves us with a pretty fascinating final thought. You know, if 1 in 4 of us is walking around with a tiny hidden doorway in our heart, what other common unseen vulnerabilities might exist inside of all of us? What little quirks are just silently shaping our health, waiting for exactly the right or wrong circumstances to suddenly make themselves known?